So, I'm Lakshmi. I have done Bachelor Science in Speech and Hearing at AIISH. That was a 4-year program, and then soon after bachelor's, I joined into master's program in audiology. That's a specialization in hearing science related to hearing disorders and treating persons with hearing impairment and so on. I am a faculty here at Oklahoma University Health Sciences Center in Oklahoma State in US. I completed my master's in audiology and I have done my PhD at James Madison University in Virginia. Uh, and I graduated there in 2020 and I'm working here since a year now as a faculty. My area of research is with amplification outcome measures, the way we quantify the benefit from amplification, be it your hearing aids or cochlear implants. So I'm currently working on developing a clinical tool to measure how much cognitive load that a person has to invest to understand speech in difficult situations, like when there is noise, um, you don't know the context of speech that you're listening to, or be it a person speaking in a new accent, any of those situations. So the main work that we are doing in our lab is to develop a clinical tool to kind of measure our cognitive load when we listen to speech, like how much effort we spend. Because even though two persons can understand speech the same way, the amount of effort they put into understand speech may be different, and that might decide the success of fitting with a hearing aid. It's a busy life for students at AIISH. The working hours are from 9 to 5:30, so you're always in on campus and in classes or in clinics. Then the thing that I liked the most was National Service Scheme, like working as a volunteer for NSS. NSS is actually, I have worked as a volunteer and also as a student leader when I was in my master's program. We did a lot of like service activities like blood donation, arranging camps for persons with communication problems all over India, like a lot of places. So we got to see different places and treat persons with communication disorders in different places. And in and around Mysore, we used to go for cleaning the areas and all of those. And it's a lot of it's like it was a great opportunity to have our own little group, and it was like community building activity, learning leadership. Those were the experiences with being in NSS. Yeah. um Again, I would say like it's Aish is kind of a high demand environment, like, and you're it's a professional course. It's not just like any other college degree that we do, because you're responsible for giving therapy to a person, like treating patients and all of that. So you're becoming more responsible in your life. You're like, because you're taking care of other people basically. So I think it played a very important role for the longest time, like for till my 12th grade. Whatever I studied was like, I never knew what was the purpose of whatever I learned as knowledge, like uh, concepts or anything. But coming to Aish changed that a lot. For whatever you learn in class, you get to apply the same evening, maybe in clinics. So it gave kind of a sense of purpose for me personally. So that was the biggest change for me. And uh, we have a very high prevalence of communication disorders in India, and it's a social burden, it's an economical burden. And we as professionals, like professionals in the field of speech and hearing or communication disorder sciences and disorders, uh, we help society or persons with special abilities to communicate in the basic thing, communication with their loved ones, being connected to society, and inclusion of those persons into society, and kind of uh, make them take their first steps towards being self-reliant. In a lot of ways we do contribute to the society also, and uh, personally it gives a great sense of satisfaction, and it gives you a purpose in life and all of that. And it's a very important profession, and we need a lot of people who can serve our community basically. So students at AIISH come from all walks of life, come from all over India. So it's like exposure to a lot of things like different languages, different cultures, and all of that. So it's a great place to kind of open yourself up to the world. So as students, I think it's in our formative years that's very important to have such great exposure to different things. We have really good faculty, like a group of faculties who can teach you, who are the best in India and outside also. Like, so very good faculty to learn from professionally, like how to conduct yourself in clinics and treat patients, and also learning the theory behind in classes. We have world class facility in related to communication sciences and disorders, be it our huge library, which has every possible book you can imagine in our field, or it can be clinical equipments. They cost like crores, maybe some of the specialized equipments, and we have all of them. We do, like AIISH does technology upgrade every now and then. So we have every new equipment, every manufacturer's equipment that we can look at. I don't think any other place has so much facility in terms of equipment and so on. That makes it special place. You have access to, like we are in clinics every day, like for 4 hours, and the number of patients that we see is huge, a large number of patients. So learning from that is a big benefit. We get interprofessional education, that is we are taught by uh, different professionals. We learn from ENT doctors, we learn from pediatrician, we learn from neurologist, we learn from physiotherapist, occupational therapist, you name them, like whichever profession that we can collaborate with possibly, we have on our campus. And having exposure and learning the scope of practice of other professionals is a very key thing to be a successful professional, like an audiologist or speech language pathologist, being able to collaborate with other professionals and work for your patients. So that's great at AIISH. You get really good interprofessional education. So being in this profession has taught me empathy, how to understand how the other person is feeling, and how to be supportive of that person, but not being sympathetic. So that's one thing I have learned personally. And as I said, Aish is a place where you get exposed to different cultures, languages, and all. So I think I have become more of an open-minded person. So the profession in itself, it teaches you acceptance, and look for something good beyond your problems. Like that's what we are trying to do with our patients. Even though they have some barriers due to their problems, disability, whatever you want to call it, uh, look beyond that and find hope in life, kind of, and make your quality of life better and better. On society, as I said, we have a great need throughout the world. It's uh, hearing impairment is a leading uh, like disability in persons who are elderly. I think it's the second most leading disability, and it is definitely a social burden and economic burden on our society basically. And it all stems from the reason that we tend to exclude these people who have disability and try to care them differently than including them in our regular society and make them self-sufficient, uh, see their ability to contribute to the society, kind of. Our profession is a place or a professionals who help these persons to understand their abilities and kind of become self-reliant and in the society, and help them to get included into the society. So uh, that's a major impact that we have. And I must say our program, like communication sensors and disorders, it's actually a plethora of like a lot of professions combined into one, because if you're a speech language pathologist, you can specialize in so many different fields. Like you can become a voice specialist, you can become adult language disorders specialist, child language disorders, you have fluency problem, so specialist in that field, craniofacial anomalies and treating that. So it, you can specialize in so or swallowing problems, and there are so many different options or specialization areas that you can get into. If you're interested in research, you can specialize and do your research, get into academia, teach upcoming students. That's one thing. Or if you are want to be on the service side, you can always have your own private practice. In Karnataka, we have NPPCD program, that is National Program for Prevention and Control of Deafness. So that requires that every district hospital has an audiologist. So you get to work in medical centers in every district, work with doctors to educate grassroots level workers, and also treat persons with hearing impairment. So that is an option. You can uh, do for your further studies in doctoral degree. So this is a profession you can do academic growth also. There's you can start, you will start with your bachelor's degree, but you can go up to your doctoral, postdoctoral degrees. And so there's a lot of things you can do there. AIISH also has PhD program as well, PhD and postdoctoral program. So you can enroll in there. Yeah, even in abroad, you can work as a clinician, or you can get into research field. You can work in academia again. So there are a lot of opportunities to do PhD, because at least I can speak for USA, because I have been here and I have known the education system here. And the biggest debate here is uh, lack of PhD students, like research line, students in research line. So there are so many PhD positions that are available and give you a lot of resources to work with, to be in that program. Uh, but however, there is not enough supply according to the demand. Demand is high, supply is less. So there's always a lot of opportunity to get into the research line. I would suggest the students who are coming into uh, uh, AIISH for their bachelor program or master's program. AIISH has a lot to offer to you. It has great teachers in the field. It has a lot of facilities and a lot of opportunities to grow as a professional and also as a person. So it's a great place to join. As we all know, the COVID is affecting India badly, and a lot of people are getting affected. So, uh, just remember to stay home, stay safe, and we know, like in these days, the communication has majorly transferred to talking on phones or making video calls and so on. So. Listening can be taxing, it can become effortful, especially if you're on phone for long times. So uh, give breaks to your ears, and try to always monitor the volume you're listening at. It's not so good to listen to speech at really high volumes for a long duration of time. It's not good for your ears. Make sure you give break and let your ears relax.